I know I have a worldwide audience, but I'll just talk to my United States folks. We have a president of the United States. He has this discoloration on his hand. We're not sure where this discoloration is coming from, but we're concerned. We're starting to put two and two together. And I think the only way we'll get an answer is if they tell us the answer, or we just have to kind of assume, because this administration isn't really big on telling. But regardless if you're the president or not, there are signs and symptoms that you should be looking out for when you're concerned that you may have heart failure. Of course, you should go see your doctor. All right, so looks like the conversation is heart failure, right? And who would have thought that our president of the United States, President Trump, would be the leading driver for people to want to look up what are the signs and symptoms of heart failure. So if you don't know what I'm talking about, over the weekend, it was discovered due to some really bad makeup. I'd have to say, some really bad makeup. It didn't match. Again, I'm not a makeup expert, won't even act like I am, but some really bad makeup, a really bad cover-up job of the president's hand. And there was all of these theories that started popping out as far as like, why is his hands discolored? Because clearly it's discolored because you don't put makeup on a certain part of the hand if there's not discoloration on that part of the hand. And people are trying to figure out why. I saw one interesting theory, very interesting, that the president had uncontrolled heart failure. And because they had uncontrolled heart failure, they had to receive IV medications to deal with that uncontrolled heart failure. And the bruising is what is left on his arm. I like that theory. First of all, let me make sure I put my disclosure out here. I don't know what the president got. I'm not even going to guess. Well, I will guess. I'm not even going to make a definitive statement what the president has, but I do like the conversation that is being had about heart failure, because heart failure is one of those diseases that, when not in check, will cause a lot of problems. Typically, I see this, and I'll just, give my background. Typically, I see around holidays, especially during the winter breaks, is when like patients will deal with what we call exacerbation of their heart failure. So what does this kind of mean? And what are the symptoms and all those things? So that's what we're going to talk about today. We're going to talk about the president. We're going to talk about heart failure. We're going to talk about, does he have heart failure? Is this something we should be worried about? Let's just get into it, because like I said, shout out to our president for driving this conversation on, does the president have heart failure? Or is his ankles just really, really swollen? All right, so let's get the president out the way, right? So over the weekend, again, he has this discoloration on his hand, and it looks like due to some bad makeup that is covering this discoloration that we're trying to figure out, why does he have discoloration on his hand? Like, why there? It is a very typical spot when people are getting IVs to get IV medication in, right? The hand. Now, typically, and I will say this, right? Because I will combat. A lot of times they try to avoid using the hand. They try to go up as high as possible first, like the arm, the elbow area, and get their IVs there, especially if you have to remain there for a certain period of time frame. But it's not to say that they won't do the hand, right? Because they do the hand a lot, especially in the hospitals. But it's not a favorite spot unless you have poor veins, which again kind of leads to what we'll be talking about today. And that's why they end up having to use the hand, because that was like the best vein that they can get. So he has discoloration. These theories are going out. They're starting to put the pieces together. Again, there's one TikTok. If I remember, I will definitely, by the time this episode comes out, it will be a link in the show notes as far as that TikTok I'm referencing. So they start putting two and two together and say, hey, you know what? This guy has really bad ankles. He's already overweight. He's slow. He kind of walks with rigidity. And now he has this bruise on his hand where he's likely getting IV medications for something. Now, of course, if you're the president of the United States, it's not like you have to get admitted to the ER and go to the hospital to get some medications. The medications and the treatment likely come to you, right? So the question they're trying to figure out is, why is this happening? And the theory was like, all right, we think he has heart failure. Why do we think he has heart failure? What are some of the clues that may make us start Googling what is heart failure? Again, shout out to y'all for Googling the heart failure to want to empower yourself for better health, right? So we talk about this, and there's different types, but the most common type is kind of left-sided heart failure, which essentially what occurs is that the heart, which is a muscle, can no longer do its job as adequately and as efficiently as possible. So its normal job is to pump blood out to the rest of the body. But when it can't do that, you start having this backflow. And when you start having backflow, what typically will occur is that you start having what we say edema. You start having this fluid built up in the lungs, in the legs, because all of a sudden it used to being able to go through the heart. Now it can't. So you start having to back up in traffic. And what we would typically see in our patients, heart failure patients, is prototypically they will have either lower extremity edema or they'll have issues with shortness of breath because the fluid is actually in their lungs. So they're looking at this president like, hey, I've seen his legs. Those legs look swollen and chunky. Some bruising on his legs. And now like he has this bruising on his hand. I think he has heart failure, right? Again, like I said, kudos to the detective if you happen to be right. We'll never know, right? Because, per his doctor, he has a clean bill of health. I don't know about that. Per his doctor, has a clean bill of health. So here we have these signs and symptoms of, all right, is he getting medication? Is he not getting medications? If he's not getting medications, why is his arm bruised there? What are some other causes to have like really pitting edema and lower ankle swelling, right? That's what we're going to really get into today, right? Because again, these are some of the things that I always like to point out. What are some things that can cause you to have, especially like your ankles being swollen and edema? Obviously, sitting and standing too long. Most of y'all know under that, like if you're sitting at your desk too long, or you're sitting at your job, or you're standing up at your job too long. Shout out to my cashiers. Guess what? The fluid has really nowhere to go but down. So boom, it goes down. High salt intake, which we know this president likes his fast food. It shocked me if he has an increased salt intake because he really, really loves his fast food. There's certain medications that will do it, steroids that will do it. Obviously, we talk about diabetic medication. Again, this guy says, and his doctor says he has a clean bill of health, whatever. Heart issues, which is kind of what we're discussing today with the heart failure, blood clots, infection. So there's a lot of different reasons that could lead you to believe that someone has, lower ankle swelling, right? Like edema in the ankles, right? So we got some options. I'm just saying, I say all that to say we do have some options. It doesn't necessarily have to be heart failure, but it is a concern that we should think about. Because like I said, this guy is the president of the United States, right? Like we should kind of know if he's dealing with some medical issues, right? Because again, when our last president of the United States, like they tried to drive home the fact that he might have been dealing with some medical issues over and over and over again. In fact, they disqualified him for being president because they felt like he was dealing with, medical issues over and over and over again, right? So again, we're just, especially to be fair, right? We just want to know, right? So again, that's what kind of caused my alarm to kind of start ringing. Because like I said, it was weird that he has this discoloration on his hand. Why does he have discoloration on his hand? Our president isn't a spring chicken, not a spring chicken. And there are patients who especially my elderly patients, what we call senile purpura. And what that means is and these are the people who will bump into coffee tables, hit their hand on anything, and it just leaves a really bad bruise. Now, typically you would expect that to be everywhere. You expect, so if you have it on the right hand, you expect it on the left. So it is weird that only one side will be affected, but typically you can have patients. Go check your grandparents out right now, and you're going to see that on their legs and their hands, elbows, they're going to have this random bruising, and you're going to be like, Grandma, Grandpa, what's this bruising come from? And they're never going to know, right? And what typically happens is they don't realize it. They just happen to bump the coffee table or bump the kitchen table or bump their bed as they normally do. But this time, because of the senile purpura, which is really more of a collagen related issue, shout out to my derm folks, now all of a sudden it causes a bruise that doesn't really seem to dissipate, right? So that's kind of, again, that's kind of the role that we're leaning into, especially when we start thinking about, possible causes of it. Like I said, I do love the theories because they are very interesting to say the least, right? And this is because as a physician, when they were telling us his health is pristine, right? This was the doc. If I get the quote from the doctor, I would definitely put it in the show notes, right? Because it just sounded ridiculous that a guy who I'm looking at who looks like Trump is in pristine health. Pristine? Like if you say he doesn't have any significant issues, okay, I'm rocking with you. But pristine health? Right? Like I know there's fibbing and I know there's misinformation with this administration, but like that was probably one of the biggest aspects of it, right? And of course, if some issue were to occur, I'm going to look at this doctor a little funny. Who said that, President Trump is pristine shape and health and everything else. And then something like this may come out, right? I'm gonna look at them a little. I already look at them funny anyways, but I'm gonna look at them even more funny. I might take the glasses off to look at them and say, yeah, you were talking crazy, right? So let's talk about these issues, especially with edema and heart failure and kind of whatnot. I have a patient, right, when I was doing outpatient medicine who this was a common occurrence dealing with his heart failure. Why? because he commonly loved enjoying his salt. You have some people who are dealing with heart failure at such a point that they can't even really eat high salty foods. In fact, if they mess around and eat a bag of potato chips, that body retains all of the fluid to the point where they're on either low salt or no salt diet, because any imbalance in the salt causes it to tip over, and then fluid filled up in the lungs or fluid filled up in the legs. So my patient, he comes to me, he says, "Doc, it's happening again." And he had gotten so used to dealing with this issue with the heart failure. Now, again, we talk about heart failure. This is not a benign disease. This is your heart function not being able to function as it normally does, right? And what typically occurs when that also happens, guess what? You're at risk for developing cardiac arrhythmias like atrial fibrillation, atrial flutter. You're at risk for developing heart attacks because your heart function isn't doing what it needs to do as appropriately as it needs to do it. So, he typically comes in and he's, like I say, he's used to it. Typically has to double up his medications, and typically medication you're usually on are medications that will relax the heart, because guess what? Your heart's already weak as it is. So if you already have a weak heart, you don't want to overwork the heart by making it do extra work. Think about that. You don't want to make the heart do extra work, right? So you're just relaxing. You're just relaxing, heart beating away. You're just relaxing. You're trying not to get to the point where the heart has to overexert itself, right? Because if it has to overexert itself, you end up in the issue where you get into failure, where you get the fluid built up, legs and the chest, and you don't want that point. So typically you're on medications like beta blockers to try to decrease the stress of the heart. A very gold standard treatment course is on a diuretic, aka a water pill, usually those stronger ones. Try to get rid of as much excess fluid as possible. Now you do have to worry because some of those medications can affect all those medications, the water pills will affect the kidneys, right? So now I'm giving you a medication, try to get rid of this excess fluid, but I got to worry that it may put your kidneys in trouble, right? So it is this balance that you have to play around with. And for those patients who deal with this heart failure issue like that, unfortunately, the ankle edema doesn't typically go away. It usually just stays there. This is a lifelong issue. I saw one person mention maybe he can have venous insufficiency, right? And that's why his ankles are swollen. Right now, what you typically see, and what I tell you about this conversation, I like when there are events that cause people to start looking up health topics, right? And ask great questions. So they say, maybe some venous insufficiency. And I'm like, what we typically see with our patients with venous insufficiency is these big varicose veins, a lot of bruising in the ankle. We see a lot more bruising. You typically don't see bruising for patients who have heart failure, but you typically can see bruising for patients with venous insufficiency. And why is that? The way I always like to explain to my patients, blood, right? When it's in the vessel, it's cool, no problems whatsoever. But the iron deposit in blood is actually very toxic to our skin. So what happens for patients who have venous insufficiency, aka that their venous system, their veins, which normally push blood back to the heart, kind of fail, and it lets the blood flow back down because gravity flows down, so it's in your legs. All of a sudden, that blood starts seeping out, and it's actually toxic to the skin, and then you get the bruising there. Sometimes venous insufficiency can be mixed up for patients dealing with cellulitis because it does give this very dusky appearance. But typically those patients with venous insufficiency, they have, cold legs. They don't really have any other sequelae associated with infection versus a person who has infection like cellulitis. Well, I usually have some type of sequelae that says you're dealing with an infection at the same time, right? So definitely something to kind of think about in that regard, right? So, but like I said, I do like the option. I do like the fact that people are expanding their mind when they think about this heart failure and this causes of why our president, right, may have heart failure or venous insufficiency or just really bad makeup on his arm from a bruise due to senile purpura, right? Lots of different avenues to go to, and we won't know the answer because this administration isn't very truthful, period. Right, I could probably stop right there. This is not a very truthful administration, so I wouldn't expect them to come out unless something happened where we found out. I wouldn't expect them to come out and say what was going on, but it is something to keep in mind on. All right, so as we zoom out and we start, we get away from the president. If you're someone out there who's in your mind thinking, hey, you know what? I got this ankle swelling. right? Like the president, right? Sometimes I get short of breath like the president. Like, do I have heart failure? Right? These are some things I want you to know, right? So there are certain things we tend to look for, especially from a symptomatic standpoint, from a physician standpoint, to try to lean us in one direction or the other. So if you have a patient, again, we talk about the leg swelling, right? And again, like I said, leg swelling is a component of heart failure. It's not the only component, right? There are some people who have heart failure, never had leg swelling, right? Because it just fixates in the lung. But some people have heart failure, they get the lung and the heart, right? Just the lung and the leg, just to kind of give you an idea. So you got the leg swelling, the conditions of the leg swelling, whether they're painful or not. Like I said, typically our heart failure patients don't typically have pain associated with the swelling. It's just like they look down and it's just swollen. Again, how quickly it occurs. My patient who is a bad heart failure patient knows that if he goes to Thanksgiving dinner, has that piece of ham, he's in a hospital by Monday. He understands that if I get this ham, I'm going to enjoy this ham right now. But by the time Monday comes around, I'm going to be so fluid filled, I'm going to need IV medication to get rid of this fluid off of me. Like, and he understands that, and he just kind of lives with it. So how fast these things can occur associated with shortness of breath, weakness, fatigue is an issue. Kind of talked about the timing, whether it's during the day, at nighttime, chronic in nature, and then really the other associated symptoms, shortness of breath, chest pain, chest discomfort, palpitations, whether your urine is a different color. All of these different things kind of help lead us one way or the other, right? When we're thinking about heart failure, ankle swelling, ankle edema, medication effect, these are all things that your doctor, right, has to kind of put in its wastebasket before they figure out, like, all right, what am I dealing with at the time of my hand, right? Which again, is something that we do all the time. I've probably taken care of, no lie, thousands of heart failure patients, right? It's a very common thing. It's a very common thing. Like, as a resident, I definitely for sure took care of at least 200 to 400. I've been practicing for a decade after residency. Yeah, I'm up to like 1,000 plus patients. I've seen heart failure present in multiple different ways. And again, like I said, I'm looking at this president. I'm looking. I'm watching. I'm watching from afar. I'm peeping game. I'm keeping eye on. We'll keep an eye on what's going on here, but it is something important to understand, right? And again, we talked about making sure your medications are on point, making sure your diet's on point. Like I said, we know this president likes McDonald's and other foods like McDonald's, so diet's probably not top priority. He does golf, but golf, and again, don't golf people, don't kill me in the comments, right? I don't know how physically straining golf is. I've never been a golfer. I've never golfed. I never even went to Top Golf. People keep saying I need to do it. I'm a doctor. I should be golfing. It looks really boring to me. So maybe if someone can convince me, maybe put in the comments why I should be golfing. I don't know. It is what it is. So that's it right there. So before we get out of here, again, I want to highlight what prompted this all, right? We have our president of the United States. If you're in the United States, I know I have a worldwide audience, but I'll just talk to my United States folks. We have a president of the United States. He has this discoloration on his hand. We're not sure where this discoloration is coming from, but we're concerned. We're starting to put two and two together. And I think the only way we'll get an answer is if they tell us the answer, or we just have to kind of assume, because this administration isn't really big on telling. But regardless if you're the president or not, there are signs and symptoms that you should be looking out for when you're concerned that you may have heart failure. Of course, you should go see your doctor. You should go see your doctor if you even think, if you got heart failure or think you got heart failure, you should go see a doctor, because there's some steps. There's some steps along the way that we got to take care of, right? Because typically from a diagnostic standpoint, I got to do a chest x-ray. I got to do an EKG. I have to do an ultrasound of your heart, because that's how I'm really going to know how strong your heart is. Worst case scenario, I got to do a cardiac catheterization of your heart. Like, there's some things that I typically have to do when I'm diagnosing a patient with heart failure. So it's not a disease we just throw out there, right? Because again, if you had heart failure, depending on how strong your heart is, and we won't get into the numbers now, depending on how strong your heart is will depend on the types of medications I need to provide to you. So it is important that we know and understand what's going on. So again, if you are in the ilk of thinking, hey, I might have high blood pressure, I got a lot of these symptoms that they're talking about with the president, and you haven't seen your doctor yet, press pause, subscribe, and then go see your doctor. Press pause, subscribe, then go see your doctor, right? Because like in that order. If you don't do it in that order, that's okay. I would prefer you do it in that order, just to make sure we get you there, because heart failure can cause a lot of issues, a lot of concerns. It's a big reason why people end up in the hospital, hospitalized for heart attacks and everything else under the sun, right? And I don't want you to be that person. So if anything, hopefully the president possibly, right, possibly, again, we're not saying nothing here, possibly having heart failure, right, should energize you to go get your routine yearly checkup that you should be getting every single year anyway. I'm actually, now that I think about it, I'm actually due for mine. When I'm done here, I'm going to call my doctor to say, hey, like, can you book me for my annual visit? It's about that time, right? So y'all be blessed. Y'all have a great day, and I'm going to see you guys next week.